Hi everyone, I'm Taylor England and my presentation is about a mindfulness-based stress reduction program and its effects on the hypertensive population. So some background on my topic. Hypertension is a significantly elevated blood pressure, specifically a rating above 130 over 80 milligrams of mercury, and it's the third leading cause of death in the world. Hypertension is also the leading contributor to cardiovascular disease. 75 million adults are currently suffering from high blood pressure, while only half are able to actually control it. Hypertension is also known as the silent killer because many of its symptoms go unnoticed, which over prolonged periods of time will eventually lead to more serious health conditions. The primary means of controlling blood pressure are antihypertensive drugs, but many have reported side effects that typically result in decreased adherence to these drug guidelines. So because of this, a larger focus on the correlation between lifestyle factors and elevated blood pressure is needed. Many research studies have recently focused on the specific link between stress and blood pressure. Stress is defined as a reaction to a taxing situation and is associated with psychological and physical indications such as tension, anxiety, and sleeping difficulties. Stress-related factors are often due to work, financial situations, and environmental outcomes, while hypertensive individuals have been shown to experience complications when applying coping strategies during stressful situations, emphasizing on emotional and problem-focused strategies. These difficulties have found to revolve around mindfulness-based behaviors. Mindfulness can be defined as the state of being attentive to and aware of what is taking place in the present, which has been previously shown to decrease the onset of hypertension through reductions in stress in specific populations. This directs us towards a mindfulness-based stress reduction program, abbreviated as MBSR, and it focuses on developing mindfulness behaviors through meditation, yoga, and breathing techniques for outpatients who endure physical, psychological, and psychiatric disorders. Mindfulness-based stress reduction has benefited people with anxiety, depression, and eating disorders, and has improved the quality of life among people diagnosed with cancer. From this, it is believed that becoming aware of thoughts, feelings, and physical conditions can contribute to alleviating stressful influences that elevate blood pressure within people diagnosed with hypertension. So this brings me to my research question. Does a mindfulness-based stress reduction program reduce systolic and diastolic blood pressure in adult males previously diagnosed with hypertension? And this study will focus on a male population, since previous studies focused largely on the female population, indicating that women are more prone to developing chronic conditions as well as experiencing higher levels of psychological stress as opposed to men. There continue to be diverse opinions regarding a mindfulness-based stress reduction program and its effects on hypertension. While many studies have shown the benefits of an MBSR program on different health conditions, limited research is still lacking on its effects on hypertension. Almost all mindfulness-based stress reduction programs have shown to improve stress coping methods, but a 2016 single-blind randomized control and a 2017 cohort study found that an MBSR program only affected systolic blood pressure and not diastolic blood pressure. On the contrary, two randomized experimental designs completed in 2015 and 2017 had shown that both systolic and diastolic blood pressure were affected through an MBSR program. A 2014 study demonstrated that specifically yoga and meditation reduced activity of the sympathetic nerve system that is responsible for the fight or flight stress response in individuals. One further study found that an MBSR program was more beneficial than muscle relaxation methods in reducing blood pressure among hypertensive individuals. These studies also had small sample sizes and lack of follow-ups, which were considered major limitations and prevented generalization to larger populations. So with inconsistent results, it indicates that further research is needed to determine the true effects of an MBSR program on hypertension. So the proposed study will be a randomized controlled experimental design utilizing quantitative data. There will be an experimental group and a control group, and the current study will extend off of the Nihai et al. MBSR intervention. Participants will be recruited at Mass General Hospital through doctors at this specific hospital with a specialization in cardiovascular disease. Inclusion criteria for the study include adult males of at least 30 years of age who have previously been diagnosed with hypertension, specifically a blood pressure reading of greater than 130 over 80 milligrams of mercury, and have not received psychological treatment therapy for at least 3 months prior to the start of the study. Participants are not eligible if they have been diagnosed with a mental illness, if they suffer chronic conditions such as diabetes, renal disease, or cancer, or are currently using antihypertensive drugs. A t-test of a priori of two independent means was used to determine a sample size of at least 210 participants, with a medium effect size and a power of 95%. The study will be approved through the International Review Board at Mass General Hospital in Boston, Massachusetts. Informed consent will be obtained by participants prior to the start of the study, and it will notify them on the structure of the program, assure confidentiality and anonymity, and it will highlight that the purpose of the study is to determine an MBSR program's effects on reducing blood pressure. It will also discuss any potential risk factors. Prior to the start of the program, the clinical version of the structured clinical interview for Axis 1 disorders in the DSM-5 will be applied in order to assess if any psychiatric disorders are present within participants, therefore making them ineligible. This tool was tested regarding its validity and it was approved. A generic demographic questionnaire will also be provided to each group to further test eligibility for the study. 2 questionnaires will be given prior to the intervention, after the intervention, and at a 2-month follow-up for both the experimental and control group to complete. Each questionnaire focuses on specific stress-related factors, such as health promotion, coping strategies, and stress indicators that were also tested for validity and approved. A multivariate covariance analysis will be utilized to determine homogeneity of variances, and an SPSS statistical analysis will be used to determine statistical results. Patients will be asked to avoid caffeine and physical activity prior to blood pressure measurements, and blood pressure measurements of both groups will be taken prior to the start of the study, at the completion of the study, and at the 2-month follow-up. So the intervention itself is an 8-week mindfulness-based stress reduction program. The program consists of weekly 2.5-hour classes that focus on meditative practices and breathing techniques for the experimental group to complete. A licensed psychologist with experience in MBSR techniques will teach these sessions, and participants in the experimental group will be encouraged to practice meditative yoga or breathing techniques at home for 30 minutes daily, listening to audio recordings provided after each weekly session, then log their feelings in a daily diary. The control group will not take part in an MBSR program, but due to ethical considerations, they will be provided with the same audio recording at the completion of the study that the experimental group was given. It is anticipated that through a mindfulness-based stress reduction program, a hypertensive population will be able to utilize this program as a means of coping with stress in healthier ways, preventing their blood pressure from rising with the risks of developing more detrimental health conditions. If results are significant enough, the researcher will be able to reject the null hypothesis. With increased cases of diagnosed hypertension, alternative methods for managing blood pressure are important. It is estimated that 1 billion people currently have hypertension, which has been highly linked to stress. Based on the mindfulness nature of an MBSR program, it is presumed that this specific program can benefit the hypertensive population. However, the current study depicted limitations such as smaller sample sizes, higher dropout rates, and lack of follow-ups that need to be addressed in further research. Thank you for watching. I hope you enjoyed, and here is my reference slide.